Introduction. In this video we will focus on exercises designed to decouple or isolate the deep cerebellar nuclei as they relate to the midline structures, the upper extremity and lower extremities. We'll explore how we use the concept of decoupling to help in neurorehabilitation. We will also look at ways to stack methods of cerebellar activation. Introduction. In this video we will focus on exercises designed to decouple or isolate the deep cerebellar nuclei as they relate to the midline structures, the upper extremity and lower extremities. We'll explore how we use the concept of decoupling to help in neurorehabilitation. We will also look at ways to stack methods of cerebellar activation. Deep cerebellar nuclei overview. Let's take a look at the deep cerebellar nuclei. Working from midline to lateral, we have first the fastigial nucleus, seen here in teal color on the midline. Next, the interposed nuclei. There are two of them, the globose and the emboliform nuclei most laterally. We have the dentate nucleus. Body part associations, the mnemonic. Fastigial is midline, think face and spine. Emboliform, relating to movements around the elbow joint, and also the knee and the lower extremity. And the dentate, think digits, relating to the fingers, hands, and feet. An easy way to remember these associations, don't you think? Connection to motor cortex. Next, we'll look at how these deep cerebellar nuclei connect to the cortex on the opposite side. Looking at the motor homunculus, you can see the fastigial nucleus connects to the head and face motor representation on the opposite homunculus of the cortex. Notice the relative size. The larger the size representation in the motor homunculus, the more complex movements occur around the joint. Motor homunculus representations. Muscles of facial expression require a substantial amount of neural control, so their relative representation in the homunculus is quite large, comparatively speaking. As we circle around the homunculus, we see the dentate nucleus represented with the fingers and hands, or the digits. Because in humans we have dramatic and advanced movements of the hands, you can see this representation is also enlarged, not quite as large as the face, but still much larger than the next several nuclei. The globose and emboliform nuclei. Moving to the globose and emboliform nuclei, you can see that they're relatively small. That's because the movements of the shoulder and hip and the elbow and knee are not as complex as those of the fingers and the muscles of facial expression. The clinical approach. So the bright idea is this: we're going to try and isolate these individual nuclei with exercises that work the pathway from the motor strip of the opposite homunculus down through the cerebellum. This way we can get pure movements at these joints before we try to combine them into more complex movements. Pathology and rationale. It should be noted that in neurodegenerative diseases or injuries such as stroke or traumatic brain injury, these pathways, the representations in the motor homunculus and the pathways through the individual cerebellar nuclei, become blurred. This leads to abnormal motor synergies and impaired movement. With this in mind, we're going to work each individual nucleus and its associated motor pathway and observe movement in the patient until we get improved movement. Then we'll combine them all together to seek to return normal functional movement in the patient. Working with right side. For the purposes of brevity, we're going to be discussing the cerebellar nuclei and their associated exercises on the right side of the body. If you need to, you can merely do the mirror image exercises if the left cerebellum is the clinically important or the dysfunctional cerebellum. Eye movements and fastigial nucleus. Let's first take a look at eye movements and how they activate the cerebellum, particularly the fastigial nuclei and the face representation on the motor homunculus. Through internal connections and synaptic pathways, we can selectively activate the right cerebellum. We see that looking up and to the right does this. Here's the way you remember it. Whichever direction you look up and to, that side is related to that half of the cerebellum. So upper right eye gaze is associated with activation of the right cerebellum and particularly the fastigial nucleus. Eye movement patterns, the Y pattern. Moving the eyes in smooth pursuit and tracking them down and to the left is also associated with multisynaptic activation of the right cerebellum. Look at the drawing on the slide. You see this upper right to lower left diagonal line. Then coming from the midline and out to the patient's left, you'll see that horizontal movement from midline to the left can also activate the right cerebellum. Think of it as a Y laying on its side diagonally with the tail pointing up to the upper right, one arm of the Y to the lower left and the other arm of the Y horizontal left. By moving the eyes in these positions, you can activate preferentially the right fastigial nucleus. We're going to show you how to layer this concept onto other exercises. Eye movement pattern demonstration. Here you can see the actual eye movement pattern. Upper right diagonally down to the lower left, back to midline, and horizontally from the midline to the left. These are movements that are associated with right-sided cerebellar activation. Vibrational stimulus. One potent way to activate the cerebellum is through providing vibrational stimulus to the joints and tendons. This is due to the fact that large diameter joint fibers that carry information about vibration feed into the cerebellum. In our office, we use what we call hemi-stimulation, whole body vibration. You see here in the slide the patient's right arm and right leg on the vibration machine. There's stimulation going up to the right cerebellum. And you can see illustrated here the diagonal movement of the eyes that would also activate the right cerebellum, dampening contralateral input. Notice that the left foot is on a compliant surface, so it's going to dampen any vibrational input into the left side of the cerebellum. So, at least in theory, this preferentially activates the right cerebellum with the eye movement, in this case the fastigial nucleus. Top-down activation, math and language. Now, for top-down activation of the right cerebellum, we want to do tasks that are associated with the left hemisphere. Examples are mathematical calculations and also language. Two simple tasks that we have the patient do to activate the left side of the brain and ultimately stimulate the right cerebellum. From a top-down perspective, we'll have them recite multiplication tables while they're on the whole body vibration, as seen in the slide here, or we can have them do rhyming. We'll have them say cat, bat, fat, hat, etc., which is lighting up the left hemisphere. It's a language function and top-down activation of the right cerebellum. Stacking cerebellar activations. So you can see here that we have hemi-stimulation of whole body vibration on the right, eye movements and cerebral activity, plus the cortical activations with either math or language, all for the purpose of potently activating the right cerebellum. Complex curved linear motion exercises. As you know, complex or curved linear motion potently activates the cerebellum. With our midline exercise for preferentially rehabilitating the fastigial nucleus, we have the patient do a circular exercise with the head and neck. We do both forward and backward rotations, which create complex movements in the individual vertebrae that are housed in the cervical spine region. See the examples to follow. Circular motion demonstration. Watch this patient perform the circular motion, isolating the cervical spine while providing hemi-stimulation with the vibration platform. Lateral translation exercise. Next, we demonstrate right lateral translation of the head and neck with the eyes fixed straight ahead. Pay close attention to this right lateral translation movement. You'll see that this exercise reproduces one of the patterns of eye movement that activates the right cerebellum. As the head circles right, the fixed eyes are looking to the left, which activates the right fastigial nucleus of the cerebellum. We're stacking movement of the head and neck in a complex way with the eye movement pattern. Spinal biomechanics review. If you remember back to your spinal biomechanics classes, we know that translational movements of the spine are complex movements, with one part of the spine flexing and the other part of the spine extending, or laterally flexing in the opposite way. Torso translation, upper thoracic. We have two torso translational exercises that create complex motions. The first one, we keep the pelvis stationary and translate the shoulders, keeping them parallel with the floor to the patient's right. This creates a complex motion in the upper thoracic spine. Torso translation, lower spine. The second translational exercise, fixing the neck and shoulders parallel to the ground and moving the pelvis from midline, translating it to the right side of the patient. These are both complex movements in the spine which should activate the fastigial nucleus of the deep cerebellar nuclei. Let's see what this looks like. Mirror image for left cerebellum. Now, you should know that if we were treating the left cerebellum, just picture the mirror image where the patient's left foot and left arm would be on the whole body vibration, the right on the compliant surface. The angle of the eye movement would be the mirror image, top left, down right, because the right side of the brain can be related to spatial orientation. You can utilize mental rotation exercises or tasks and also have the patient visualize a bistable image. both of which are known to activate the right side of the brain and the left cerebellum from a top-down perspective. That concludes our discussion for today. I hope you found this information valuable for your clinical practice. Thank you for your attention, and I wish you continued success in your work with patients. I hope to see you again at a future lecture.